Hey everyone, it's your Sedative Physio and I welcome you all to this lecture. In this lecture, we are going to discuss about the physiotherapy management of scoliosis. In the previous lecture, we had already discussed about the basic stuffs of scoliosis, like what is scoliosis, what are the different characteristic features of the scoliosis, what are the different types of scoliosis, and what are the clinical manifestations of the scoliosis. Apart from this all, we have also discussed about the assessment for the scoliosis patient. Now moving further in that particular lecture, here today we will mainly focus on the physiotherapy management of scoliosis. Now we all know that if a person is having a scoliosis, we can treat it with physiotherapy. If there is any severe type of scoliosis or the angle of curvature is very high, then the patient must go for surgical interventions. Then in such cases, post-operative physiotherapy management is also very important. So here we will discuss about both post-operative physiotherapy management and a general treatment protocol for the scoliosis patient. If you want the notes of this topic, you can simply DM me on the Instagram. I will provide you the same. And if you want the lectures in Hindi language, you can check out our other channel, Sedative Physio, where I upload the lectures in Hindi language. Currently, I am proceeding with the PT Neuro on that particular channel, and here I am proceeding with the orthopedics. Okay, now so let's proceed to the physiotherapy management for scoliosis. So, for physiotherapy management of scoliosis, now we can go for either conservative method or the surgical method. Now, the surgical method is applicable only if the curvature is very high, the angle of the curvature is very high, and it cannot be treated with physiotherapy. Then the patient must go under the surgical interventions. And after the surgical interventions, we physiotherapists play an important role in the recovery and in the rehabilitation of the patient. But if we talk about the conservative method, generally in the growing children, if there is any type of scoliosis, if there is any type of curvature that is seen in the growing children, then in the growing children, basically conservative treatment is indicated. Surgical interventions are very less indicated in the growing children, because in the growing children we can recover the scoliosis, we can recover the curvature only through the physiotherapy. Okay, so in the growing children, conservative treatment is indicated with a curve less than 40 degrees. Now in some cases, if the curvature is more than 40 degrees, if the degree of the curvature is more than 40 degrees, then in such cases we cannot proceed only with the physiotherapy. In such cases, the surgical interventions are indicated. It means if there is a growing children and the curvature of the scoliosis and the curvature of the spine is below 40 degrees, is less than 40 degrees, then we can proceed only with the conservative treatment or the physiotherapy management. But if the angle of the curvature is more than 40 degrees, then surgical interventions can be used to recover that particular curvature. Then after, we will play a role in the rehabilitation of the patient. Now in the patients of scoliosis, general body relaxation or whole body relaxation is very important. We have to relax the patient, we have to perform some relaxation exercises. Okay, we can go for some stretching, we can go for some MFR, we can release the soft tissues either manually or through instrument, that is IESTM. We can perform MFR or we can perform IESTM for the body relaxation. Then the patient is trained to hold the correct posture. Generally, we can see that the scoliosis is mostly due to the postural abnormalities. Okay, postural scoliosis is mostly seen in today's era. So we have to go for postural training. We have to train the patient to maintain the correct posture. We have to train the patient and we have to tell them how they can maintain their correct posture. Okay, so training of the postural training is very important in scoliosis or any type of spinal deformities. Correct posture is very important, because an incorrect posture and the deformity can lead to different neurological symptoms too, because in the spine there are spinal nerves that are being originated from the spinal segments, and if there is incorrect posture in the spine, then it can lead to some compression, some type of tension in the nerve that is being originated from the spinal segments, and it can lead to some neurological complications too. That's why, especially in the spine, the correct posture, the training of the correct posture is very important in any type of a spinal deformity. Apart from this, we have to go for the deep breathing exercises, and along with the deep breathing exercises, we can also proceed with some other types of chest physiotherapy exercises, because in the patients with scoliosis, there can be some complications with the chest mobility. There can be compromised breathing techniques, there can be compromised muscle function of the breathing, like the pectorals cannot work very well, it can be shortened. So we have to go for different exercises for the breathing techniques, like we can go for deep breathing techniques, we can go for some intercostal stretch, we can go for some neurophysiological breathing stimulation. Okay, these all will help to enhance the relaxation inside the patient. Apart from this, we have to go for the balance exercises. Now see, If there is any deformity in the spine, if the spinal curvature has changed, then the weight bearing and the weight transfer of the body from upper trunk to towards the lower extremity will got unbalanced. So we have to train for the balance. We have to go for the balance exercises. For the balance exercises, we can use the balancing board. We can use the balancing board, or we can also use the Swiss ball, or we can also say that the physio ball. We can also use Swiss ball, balancing board, and we can also use the blasters can also be used in the balancing exercises. Apart from this, well, we can do some other positioning exercises, like we can go for the half kneeling, we can go for the kneeling, we can go for the half kneeling with reaching, then again kneeling with reaching. So we can complicate the exercises as per the assessment and as per the condition of the patient. Apart from the balancing exercises, we can go for the stretching of the tight soft tissues. Now in such cases, in the cases of deformities, for prolonged deformities, the soft tissues around the joints got very stiff, so we have to stretch that soft tissues, we have to release that soft tissues. And initially we can start with the soft tissue manipulation. We can go for the MFR, myofascial release. We can use IESTM, instrument assisted soft tissue manipulation. Okay, so these all techniques can be used for the soft tissue release. Then strengthening exercises for spinal extensors and abdominalis. In case of scoliosis, basically what we see, the spinal extensors and the abdominals got weakened because the spinal curvature of the patient has changed and these muscles have lost their function. Because of the disuse of these muscles, the muscle power of spinal extensors and abdominals can decrease. So we have to go for the strength training exercises for the spinal extensors and abdominalis. Then spinal mobilization. We have to go for the spinal mobilization, especially on that particular segment that is more affected. If the affected area is the thoracic segment, if the affected area is the upper thoracic segment, then we have to go for the mobilization of the upper thoracic segment especially. Okay, we have to go for each vertebra like T1, T2, T3, T4, and we can also go for a whole segment like upper thoracic segment, the middle thoracic segment, the lower thoracic segment. Okay. Apart from the spinal mobilization, we can also use some Mulligan techniques like nag, snag. We can also use that here. Then correction of shortened soft tissues on the concave side of the curvature. Now, if the person is having scoliosis, then in the spine there will be lateral curvature. It means one side will be convex and the other side will be concave. Now the concave side of the person will have more shortened soft tissues. Okay, so we have to focus on that particular concave side soft tissues. We have to stretch that soft tissues, we have to manipulate that soft tissues to get its normal size and to function it well. Okay, then we have then we can also use some braces like thoraco-lumbosacral orthosis. We can use it. We can use cervico-thoraco-lumbosacral orthosis. Now these orthoses can be used to support the posture of the patient. If the patient is not able to maintain the trained posture, if the patient is not able to maintain the correct posture, then we can use braces. These braces can help the patient to be in a good and correct posture. And we can choose the orthosis, we can choose the braces with the reference of the segment that is being involved in the patient body. Okay, apart from this all, repeated stretching sessions for the hip flexors and hamstrings. Now in the patient of scoliosis, the hip flexors and hamstrings also got affected. The shortening of hip flexors and the shortening of hamstrings can also be seen. So we have to go for the hip flexor and hamstrings stretching. We can also go for some strengthening exercises of the hip flexors and hamstrings if the MMT of these two muscles are less. Okay, so in the assessment time, we have to go for the MMT also for some specific muscles, like for the spinal extensors, spinal flexors, the abdominalis, the hip flexors and hamstrings, etc. And as per the MMT record, as per the MMT scale, as per the MMT result, we will go for the stretching, strengthening or any type of other programs for the physiotherapy. Now, hanging position is also very important. It is also very beneficial in the patients of scoliosis. Then the patient sits on the floor with a straight back. Okay, first of all, we have to make the patient seated on the floor with back straight, then leg stretched. The patient's back will be straight, the legs will be stretched, and the patient will have to bend upper trunk forward. Something like we go for the sciatica assessment, like the slump test. In the slump test, what we do, we make the patient in the seated position, we make the patient's leg forward and we bend the patient's upper trunk forward. So something like that. Okay, then spinal mobilization. I have already told you that spinal mobilization is very important in the patients of scoliosis. Apart from this spinal mobilization, we can go for active thoracic shift exercises using the Swiss ball. On the Swiss ball, we have to perform different activities like active thoracic shift exercises, some spinal stabilization exercises. Apart from this all, if the patient has undergone the surgical interventions for the management of scoliosis, then after surgery, post surgery, what we can do? Okay, so post surgical complications are breathing abnormalities can be seen post surgery. So we have to go for some breathing exercises. If there is any secretions inside the pulmonary area of the patient, then we can mobilize the secretions. Then we can mobilize the chest secretions with some manual techniques or some mechanical techniques like percussion, vibration, etc. Or we can go for suctioning of that particular secretions. Apart from these breathing exercises, we have to go for a strong and sustained ankle and toe movement. Now, the patient is having a scoliosis, the surgery has been done in the spine, then why ankle and toe movement is important? See, if the patient is having the surgical interventions in the spine, then the patient must be bedridden and it is on the bed rest for some time. And if the patient is bedridden, then there will be no use of ankle and toe, and hence they can develop contractures because the disuse of this joint. So we have to go for the mobilization and the movement of the ankle and toe joint. So we have to go for passive movement, or the patient, if the patient is able to do active movements, we will go for the active movements, because the active participation of the patient is very important in any rehabilitation program. Active participation is very important, whether it is a case of neurology, whether it is the case of orthopedics or any other case. Active participation is very important. Why? Because it creates a positive impact on the central nervous system of the patient, and in returns the central nervous system works well. It is something like the biofeedback. Okay, apart from this, we have to go for active upper extremity movement within the pain limit. Now, apart from the ankle and toe movement, we have to go for the upper extremity movement too, but within the pain limit. The patient will not cross the pain. Okay, this will be active movement. Now, after the active movement, we will go for the slow, relaxed, passive movements in lower limbs and in upper limbs too. Now, this will be very beneficial if there is any problem and issues related with the range of motion of some joints. So, this will increase, and this will help to increase the range of motion of that particular joint. Then, we have to careful assess, we have to careful monitor the patients for any neurological symptoms, because as I have already told you that in the case of a scoliosis or in the case of any spinal deformities, the neurological symptoms can be seen because of the compression or because of the tension in the nerve. So in such post-operative cases, we have to careful monitor the patient for some neurological symptoms. If there is any neurological symptoms, then we will have to proceed for that particular symptoms too. Okay, now the patients are turned to sides alternating with prone position every 2 hours. The patient will have to turn both sides, like in the sideline towards the left side and in the sideline towards the right side. This will alternate every 2 hours. Gradually, guidance in sitting and standing can be initiated with assistance. After some days, we will start sitting and standing of the patient, but with assistance, we will passively guide the patient for the sitting and standing movement. Now, the patient will have to get rid from the bed, because we have to train the patient for the activities of daily living. We have to make the patient independent. So, from getting down of the bed is taught by, first of all, the patient will roll and it will go to the prone line. Then from prone to, it will come to kneeling. Then from kneeling to getting down by slowly sliding down the foot end of the bed. That means, first of all, we will train the patient to go into prone by rolling. Then from prone, the patient will come into kneeling position. After kneeling, the patient will slowly slide down from the foot end of the bed, and it will get rid of the bed. It will get down off the bed. In such steps, we can train the patient. Okay. After this, initially lumbar roll may be provided in sitting. In sitting position, we can train the patient to turn, to roll, especially from the lumbar area. Then progress to chair sitting without backrest with correct guidance. We will progress the exercise. If the patient has mastered the previous exercise, then only we will have to move for the progression and the complicated exercises. Okay. If the patient has mastered, then we will now move to the more complicated exercise, like we will make the patient seated on a chair, but without the backrest. The chair will not have any type of backrest. Okay, there will be no backrest, and the patient will sit on the chair, and we will guide the patient to maintain the correct posture. We will help the patient to maintain the correct posture, and we will train the patient to make such posture. Okay, this will help the patient to learn and support the spine actively. Okay, first of all, we will start passively. We will passively give the support. We will guide the patient for the proper spinal posture on the chair. and gradually the patient will learn, and gradually the patient's central nervous system will learn that how to maintain the spine posture actively. Okay. Now, standing should be initiated. The patient has been now in sitting position. The sitting is all right. Now we have to stand the patient. For standing, we have to initiate from the supine. From supine, then hanging the legs to the side of the bed. First of all, from the supine, the patient will hang the legs to the side of the bed. Then lifting the trunk with hand support. Patient will use his or her hand for the support, and he or she will lift the trunk. Okay. So in such method we can train for the standing. As soon as the balance in the standing position is achieved, now we have to train the patient for a proper balancing in a standing position. When the standing position balanced is achieved, now how can we train the patient to make the balance? For balance we can use the balancing board or we can use the blasters too. Okay, so after all these stuffs, we will initiate the walking, we will initiate the gait training of the patient. Now if the gait is normal, then there is no issue with it. If the gait is abnormal, then we will initiate the walking and the gait pattern. We will start with some basic stuffs like and for a proper gait pattern, first of all, a proper muscle properties is very important, so we have to check for that also. If the muscle properties is not well, if the muscle tone is not well, if the muscle strength is not well, the patient will not go for any type of gait pattern, any type of correct gait pattern. So we have to go for the muscle assessment too. We have to check for the muscle properties, we have to check for the muscle tone, we have to check for the muscle strength, if there is any stiffness or spasm in the muscle of the patient. So we have to go for all this assessment. Then we will start walking with a correct gait pattern, and we will progress it to achieve physical independence. Our primary goal is to make the patient independent. The patient should have the independent life, the patient should have no issues with the ADL. Okay, so we will start the gait training and progress it to achieve the physical independence. We can also use some purposeful movements. We can also use some goal oriented movements for the gait training. We can start the gait training from the parallel bars with the patient holding both the bars, and he or she will walk between the bars. Then after the bars we can progress to the mobility aids, like we can use the walkers, we can use the crutch, and after the crutch we will go for the independent walking. So in such manner we will progress the gait training of the patient. Now when the patient will start to walk independently, then we can complicate the exercise, like we can go for the reverse walking, we can go for the side stepping. When all these are mastered, then we will go for the stair climbing, and a stair descending. Now in the stair climbing, again we can complicate the exercise. How? Initially we will start the stair climbing with the support of a railing, but after some time, when the patient is now able to climb and descend the stair with the help of railing, now we will remove the railing, and without any support we will ask the patient to climb the stair and to descend the stair. Now the patient should be made walk in parallel bars, as I have already told you that initially we will start with the parallel bars with the height of the handrail raised and adjusted to avoid forward flexion of the spine. We have to take care of one thing, that the patient should not go for forward flexion. The spine of the patient should not go for forward flexion. Otherwise it can cause other complications, because this is the post-operative condition. We have to take more care of the patient. Okay, then we can use crutches also. Auxiliary crutch can be used in the patient with the post-operative case, or in the normal case if the patient has not undergone the surgery. In such cases also we can use the auxiliary crutch, or any type of walkers can also be used. Okay, but there is some issue with the walker. If we use the walker with the patient's upper trunk will bend forward, or in other words the spine will go into forward flexion, and we have to prohibit the forward flexion of the spine. So in walkers there is some complication. It's better that we will use the auxiliary crutch for the patient gait training. Okay, so this was the explanation on the physiotherapy management for the scoliosis patient, and I hope you all learned it very well. If there is any doubt regarding this topic, okay, you can simply DM me on the Instagram, you can simply comment on the video below, or you can also WhatsApp me on the number given in the description box below. So I will see you guys in the next lecture. Till then, be happy and keep learning.